Hi.
Hi.
Nice to have this interview. Thank you very much for your time and have this opportunity to talk to you. And far away, but so close in the things that are working out nowadays.
Well, I'm glad you wanted to do the interview. You know, you and I go back, more than 20 years, I think.
Yeah, I think so too. Well, I would like you, even though everybody knows you, to introduce yourself in the way that you feel comfortable, that you like to be introduced for interviews like that, for example.
Sure. Okay, so I'm Judith Beck. I'm president of the Beck Institute for Cognitive Behavior Therapy in Philadelphia. We're a nonprofit organization, and our mission is really to improve lives worldwide through excellence and innovation in CBT practice and training and research. And I'm also a clinical professor of psychology in the Department of Psychiatry at the University of Pennsylvania. So those are my big titles.
Okay.
Mostly what I do is teaching, because our center is really devoted to doing both national and international training in CBT. I also see patients. I do a little bit of supervision. I do a lot of administrative work. I do a lot of writing. I consult to various programs, and I don't know, I'm very lucky. I have a very varied job.
Well, since you have so many points and you being a reference in cognitive behavior therapy worldwide, what's one of your main spots, your hot spot, your interest nowadays that you are working as a teacher, as a writer right now?
Okay, so the thing I'm most excited about is the 3rd edition of my book, which I just happen to have right here.
Okay.
It's Cognitive Behavior Therapy Basics and Beyond. And I'm really excited about this book for a number of reasons. One is that throughout the book, I have included a recovery orientation. Maybe we can talk more about that in a couple of minutes. The second thing is the book reflects my own growth as a therapist. I really am so much of a better therapist now than I was 5 years ago, or even longer since the publication of the 2nd edition of the book. I have learned so much. A lot of it has to do with the recovery orientation. Some of it has to do with integrating mindfulness into CBT and using techniques from really almost any psychotherapeutic modality that's evidence-based. The other reason I'm really excited about this book, because this is something I've wanted to do for so long, and that is to allow people to stream videos of therapy sessions that I've conducted. So there's a website that goes along with the book where people can watch videos of therapy sessions, they can download worksheets, they can download diagrams. And so I think it's a much better learning experience than before. I also, in this new edition, have included clinical tips. So when the basics don't seem to be working, here's some clinical tips about what to do with challenging problems. I followed 2 patients throughout the book. And the reason I did this was because I got so much feedback from the first 2 editions that the client that I used, whose name was Sally, and based on a real client that I had treated, was just too easy, too straightforward. So this time, I follow Abe throughout the book, and you can watch some of his therapy sessions. So Abe is in his 50s. He's been severely depressed for more than 2 years. He is divorced. He's now unemployed. And he's having a really hard time. He's at the beginning of treatment, and he's also, of course, based on a real client, but I've changed some details for confidentiality, but he literally spends most of his day just sitting on the couch. So he's a much more difficult client. But I also follow Maria through the book. Maria is a person who's diagnosed with depression, but also has borderline personality traits.
Okay.
So sometimes I will use Abe as the main example and then show how I might have to vary treatment for someone who poses a little bit more of a challenge. So those are some of the changes in the book. I also include practice exercises for people to do and a lot more resources.
Your book was certainly a breakthrough for cognitive behavioral therapy learning, you know, your first and second edition. And you're showing you're very excited and enjoying and study and prepare a lot this new edition. If you would say like things that you like the most while you were developing this new edition, the thing that you like more to do,
right,
doing the book.
In doing the book, I included this recovery orientation that I mentioned before. So the recovery movement was started in the United States about 50 years ago by people who are diagnosed with a much more serious mental health condition, such as schizophrenia or bipolar disorder. And these were people who thought they were not well served by the medical model. And instead, they define recovery as working toward living the life that you really want and being your best self. And really, the goal of treatment is not so much to reduce symptoms of depression, for example. The goal is much more focused on helping people identify their aspirations, what they really want for their lives, identify their key values, give them a sense of hope and purpose, help them feel more connected to other people, have a sense of empowerment, a sense of purpose and hope. It's a much more positive focus kind of orientation. And I'll tell you, with the higher functioning outpatients whom I see at the Beck Institute, there are two places in treatment which are really quite different from what I used to do. One is at the beginning of sessions. I'm always careful to assess what the patient's sense of well-being has been like in the past week, say 0 to 10, and what the range was, and then to find out what kind of experiences the patient had in the past week in which they had a better sense of well-being. So I have the patients identify those experiences and then help them draw positive conclusions about those experiences. Just this week, I was talking to a client who had had such an important experience during the week. She had actually been working for a very long time to set up a special project at her church. And she finally had attended a meeting where she presented this a couple of days before our appointment. And it had gone so well. So I said to her, I'll just call her Mary, her name wasn't really Mary. Mary, what does it say about you that you were able to work so hard on this project? What does it say about how brave you were to even undertake it in the first place? What was really good about doing this project? How you were really able to take control of your depression and get something done that was so important to you, something that was so much in line with your values. How did other people respond to your announcement of this project? How do you think they viewed you as a result of your having done this? So one of the things that we do differently in a recovery orientation is to pay a lot of attention to the positive experiences patients have had in the previous week and help them draw conclusions, positive conclusions about themselves, about other people, about the future. When they do, much of the time you're able to really inspire some positive emotion right in the session itself. So rather than focusing on patients' problems and symptoms, we tend to focus more on their goals and their positive experiences and experiencing positive emotion in session and between sessions. So that's one difference. Another difference is in the middle of the session, where we ask patients, what are your goals for today's session? What do you really hope to accomplish? And really the goals are just the flip side of the problem. So if the problems were things like I'm feeling very lonely, then the goal might be to get more connected with people in the coming week. And then we would say to the client, what steps do you want to take this week toward having a better connection? Then we have to collect some more information about this goal and about the steps, and we need to look for what obstacles could get in the way of taking these steps. And what are these obstacles? Well, the obstacles are usually automatic thoughts, practical problems that need to be solved, and sometimes patients need to learn certain skills, such as interpersonal skills, social skills. So we address the obstacles, and when we're finished talking about all of this, we say to the client, what do you think would be important for you to remember about what we just talked about this coming week? And we make sure that we record the most important points, and then we might also say, and do you think it might also be important to remember such and such? And also, let's make sure to record the steps that you want to take. We always tie their goals and their steps back to their aspirations and to their values. So we spend a fair amount of time right in either the evaluation or the first session finding out what are those aspirations and values are. And the reason I'm excited about this is that it has really improved my own confidence as a therapist.
Like focusing the strengths and the values, positive values that people have besides the symptoms and the negative and the distortions. Yeah.
Their strengths, their resources, their positive qualities, their accomplishments, their talents, their passion.
Yes, yes.
Exactly.
That's nice. That's very nice. Yeah. And besides this, all this passion of your third edition, is there another thing that's happening, another project nowadays that you're excited about or you're looking forward to, you know,
Sure.
put it working on, moving on?
So there are two things I'm particularly working on right now. One is expanding our online training opportunities. So now, especially in this COVID-19 era, but I think it's going to continue into the future, we're now offering everything that we used to do in person, we're now offering that online. And we're experimenting with all different kinds of webinars, different formats. I think we may start to do some clinical case conferences, but all different ways of offering training, both to individuals and also to organizations, so that the staff of a whole organization can be trained. So that's one thing. And then the second thing is we're really excited about for the first time, certifying people as Beck CBT clinicians.
Mm-hmm. Yes.
So that's been an exciting project. We're really trying to raise the bar of excellence in CBT. And aside from that, you know, I love treating patients.
Yeah. I'd like to know, you know, for like wrapping up our conversation today, how do you think, or how do you expect cognitive behavioral therapy would be like 10 years from now? What do you think that could, that must happen, or you wish could happen?
Well, I think there are a lot of things are going to happen. For one, I think we're going to be guided much more in the future by the findings from neuroscience.
Okay.
So that's one thing. The second thing is CBT continues to evolve whenever, because we have ongoing research, and ongoing research is being done all over the world for different diagnoses, for different cultures, for different developmental and intellectual levels. It's being offered not only by mental health professionals, but by a lot of medical professionals. And more, it's being adapted so that it's appropriate for us to train paraprofessionals in how to use CBT. And these paraprofessionals sometimes are working with or working in a remote village in Africa someplace, or sometimes they are people with just a high school diploma, but who are working with people with very serious mental health conditions, perhaps who are in a psychiatric hospital or in a protected residence. So as we have more and more research, there's going to be more and more application, I think, of CBT to different populations, and it will be delivered by many more kinds of people. I think another change that we're going to see in the next 10 years is more and more of this recovery orientation that I've been talking about. Yeah. Mm-hmm. I think as technology continues to improve, we're going to see that there are many different technological formats we can use. Certainly apps and online programs that are direct toward patients themselves, or might be used in conjunction with therapy. And I think if we do that, it's going to speed up therapy quite a lot. There's already some research that shows that that's true. And let's see, I think we're going to get better and better at delivering training to people, especially because of technology and because of online resources.
I think that occurred to me, talking about technology and future. We have a challenge now with the pandemic, the COVID-19 pandemic, that's most people that are kind of avoiding of technology, they're introduced to technology, right, in a very forcing way, you know. What do you think about that?
I think that's absolutely right. I think people are getting, because they need to stay connected to, say, family and friends, they're getting much more comfortable using technology. And it's so wonderful that we're able to, at least at this point, provide treatment to people all over the world. Whereas before they had to be in geographic proximity in order to do that. And I did want to say one more thing that I had forgotten. I think in 10 years, we're going to see a delivery system of treatment that is more like what you see in the UK. The UK has the IAPT system, increasing access to psychological treatments, IAPT. In this system, people go to their primary care provider, and if they're mildly to moderately depressed, they don't see the most highly experienced, highly trained people. Instead, they might be given a choice between medication and an online or in-person support group. They might be offered the chance to use a CBT app or a CBT program. If they're a little bit more depressed, then maybe they would see someone who has been trained, but not to the highest level, who would do a lot of behavioral activation with them. And it's only the people whose symptoms are the most severe who would then see the most highly trained people. And I think that CBT works so well in this system. And I think that in 10 years, we're going to see this more and more, especially in countries that, like the UK, that have more of a national health service system than we do in the United States. But I sure hope it makes its way to the United States as well.
Well, thank you very much, Judith. It was wonderful, and looking forward to meet you 10 years from now.
Oh no, I hope it's much sooner than that.
Just to talk about all those nice things that cognitive behavior therapy can give us, okay?
Wonderful, and thank you for interviewing me.
Okay, it's my pleasure. Bye-bye.